It's called CEREC 3D, and the $100,000 piece of equipment allows the dentist to make tooth restorations right in the office.
One main advantage is conservation of tooth structure. We only have to replace the missing part instead of having to grind the whole tooth down to a peg to put a crown over it when it's defective. We can simply replace just the part that's defective and bond this CEREC material to the tooth, and it strengthens the tooth almost back to its original strength.
The process uses computer-aided design instead of the old method.
Instead of taking an impression like you would normally have in the past, it takes an optical impression with an infrared camera which triangulates and measures everything, and then that goes into the computer, and then we do everything off of that. It creates a virtual model of the tooth.
Once the dentist designs the restoration, the information is sent to the milling machine, which makes the piece out of a solid block of porcelain.
And the material that it uses is the closest thing to human enamel as far as the way it wears, the way it expands and contracts under hot and cold, the closest thing to tooth enamel that there is in existence today.
Dr. Woodill says his patients are pleased with the new method.
We're quite pleased with the results, and the patients are quite pleased, and we've gotten some very positive feedback. Their tooth feels more like a normal, natural tooth instead of the way a crown might feel.
This equipment has taken 20 years to develop and has just recently received the American Dental Association's acceptance. Several local dentists now offer the procedure. Woodill says he has done about 300 so far.
For me, it's actually fun to use, which is really irrelevant as far as the patient is concerned. We're quite pleased with the way the restorations look. I think they look more natural than anything that we've seen or that we've used in the past. The one visit thing is a really big plus, to be able to walk out and have it all completed and not have to wear a temporary. The way the material it wears like tooth enamel, it just has a lot of good properties, the way it functions after it's put in and the way it feels for the patient.